going to start asking her some questions about her respiratory system. So, have you lately had any trouble breathing, any shortness of breath?
No.
How about, have you ever woken up in the middle of the night and felt like you can't catch your breath?
No.
All right. How many pillows do you sleep with at night?
2.
2. Have you had a cough at all?
No, no cough.
If she did have a cough, I would ask her if it was dry or like a productive or a wet cough. If it was a wet cough, I would ask about the quality of the sputum and how long this has been going on. And then I would start on inspecting. So I would look at her chest and make sure that her breathing is even and not labored, that she's not using any accessory muscles to breathe, anything like that. And then I would check her mucous membrane, so I'm going to have her pull down her lower lids, check her conjunctiva for her circulation, she's good, then her lower lip, and I'm going to check her palms and her nails. And while I'm down here, I'm going to have her put her fingers together like this and check for any clubbing. So she has a little window between her nails, so she's good. I'm then going to palpate her chest for crepitus. So this would be any air bubbles trapped in the subcutaneous tissue, and when you palpate on it, it's going to feel like Pop Rocks or like Rice Krispie treats. So I'm going to palpate on her chest, on the front, and the axillary region, and then I'm going to have her sit up for me real quick and palpate on her back. Alright, and then while she's up, I'm going to go ahead and auscultate her lungs. So you're going to want to listen to like laterally to her lungs so that you're looking for symmetry. So if you're listening to her right upper lobe, you're going to want to listen to her left upper lobe next. And for this one, once again, you would want to go directly onto the skin, but for this purpose, I'm just going to go under her gown. Do you mind if I lift up your gown and listen to your lung sounds?
Okay.
Okay. When I move my stethoscope, I just want you to go ahead and take a deep breath in and out through your mouth for me, okay? So go ahead and breathe. I'm going to listen to her left upper, and then her left lower, and then her right lower, and then her right middle. And I'm going to go ahead and do the same thing on her back. So on her back, I'm only listening to 4 lobes, so I would ideally go under her shirt, but for this purpose, I'm going to go over it. And I'm having you do the same thing, where I'm just going to have you breathe in and out through your mouth when I move my stethoscope. So her left upper, her right upper, her right lower, and her left lower. And you're doing all of this with the diaphragm of your stethoscope. So right here, I'm going to go ahead and check for bilateral chest expansion. So I'm going to put my hands on either side of her spine, my thumbs meeting in the middle, and have her take a deep breath in and out. And I'm watching for my thumbs to move in and out at the same time. So she's good. And then while I'm here, I'm going to check her anterior, posterior, transverse, and lateral diameter. So I'm going to use my hands and measure the side, and it should be 2. Okay, hers is good. So she has a 1-to-2 ratio, and she doesn't have a barrel chest. So after that, I would perform all my safety checks, and that is a respiratory assessment.